Hi everyone, my name is Izzy or Isabel, and today I'm going to be talking about healthy aging. So, why is healthy aging important? I feel like a lot of people, or just humanity in general, are interested in prolonging life and maybe living forever and reversing aging and all of those things, but people pouring money into this. It costs a lot of money for research and things like that. And I think it's a lot more realistic and accessible for the global population to, instead of trying to live forever or reverse aging, look at how we can live longer, better, more productive lives and age in a healthy way. And healthy aging is a complex process. There are a lot of factors that influence healthy aging, whether they be uncontrollable, like genetics, or controllable, like exercise, healthy diet, and preventative care. And this is all according to the National Institute on Aging. But my question is whether the factors they say are controllable really are in our control. For instance, what if you live in an unsafe neighborhood where you really can't go outside to walk or get exercise, or you live in a food desert where you don't have a lot of access to healthy food or just can't afford it, or live in a rural area where you really don't have access to primary care providers or preventative care. And these things all fall under social determinants of health. I really love the definition that we've been using throughout this course from Dr. Nick. And when you look at the social determinants of health, there can be large differences in life expectancy based on things such as location, socioeconomic status, and race and ethnicity, which we'll look at later. Some of the ethical questions I have about healthy aging is whose responsibility is it to address these disparities? Public health is typically run by the government, so taxpayer money. Should the government be in charge of it? Should it be private companies? How should we address these health disparities in a just manner? How can we distribute resources fairly? And overall, how can we make the process of healthy aging be more equitable and less influenced by things like social determinants of health? So, what is healthy aging? The NIH says that you need to take care of your mental, physical, and cognitive health. Those three things comprise healthy aging. And these are just a few things that they had on their website. And I wanted to specifically highlight a few of them, such as proactive healthcare for physical health. Proactive healthcare is one of the most important things that you can do to take care of your physical health. I think it's about 90% of older adults have at least one chronic disease, and like 80 something percent have two or more chronic diseases. And when you're saying chronic disease, it's things like diabetes, cardiovascular disease, cognitive decline, and things like that that can really impact your quality of life and your health. And then for mental health, managing things like social isolation is particularly important. There have been studies that call loneliness in America a pandemic right now, and also researchers that have said that, social isolation can cause as much damage as smoking 15 cigarettes a day, which if you look at physical health, not smoking is something that's also very important. So that's like doubly important for aging in a healthy way. And then cognitive health sounds similar to mental health, but that's really more talking about your cognitive capacity and not contracting things like Alzheimer's and dementia. And that really encompasses a lot of the things that you need to take care of with your physical and mental health. So, healthy aging is multifactorial and pretty hard to quantify, and so I'm going to be using life expectancy as an indicator of healthy aging. The World Health Organization actually draws a distinction between just plain global life expectancy and actual healthy life expectancy, which I think is great to see the difference with that statistic. But unfortunately, with the numbers from the United States that I got from the CDC, they don't make that distinction. So I'm just using overall life expectancy. And when you look at the US, compared to the global life expectancy, it looks like we are a little bit ahead. But I also wanted to provide the numbers for developed nations, because when you look at the statistics for life expectancy across all developed nations, the United States is actually a little bit behind other developed nations. And looking at why some of these discrepancies, or some of the discrepancies that do exist, one of them is discrepancies by location. You can see that the darker states have the higher life expectancies, where the lighter states have life expectancy differences of up to 10 years. And actually, when you're looking at smaller location regions, according to blue zones, when you look at the census tracts that are probably county size, there can be differences across the United States of up to 40 years, which I think is a crazy statistic because 40 years is almost like 2 generations. So one location in the US could live almost 2 generations longer than a different location. Another life expectancy discrepancy is socioeconomic status. So you can see that life expectancy increases a lot when you are in a household with much higher income, unfortunately. And the next discrepancy we're looking at is racial disparities by race and ethnicity. You can see that Asian people groups have the highest life expectancy, and then whereas American Indian and Alaska Natives have the lowest life expectancy, followed by Black people, and then white people are in the middle with the overall average, and Hispanic groups. And possible reasons for discrepancies. There are so many, like I talked about. Maybe you don't have access to food, or safe living environments, or primary care. And one of the important things that I wanted to highlight was coverage, access, and use of healthcare among people of color compared to white people. So when we're looking at the amount, like the number of measures worse of certain ethnicities when compared to white people, you'll see like for Hispanic and Black groups and American Indian, Alaska Native, they are perceive their care to be worse than white people. And if you remember back to the last slide, those groups have a lower expectancy than white people, so that would make sense. And then overall, social determinants of health. I chose this graph because social determinants of health really encompasses so many different factors altogether. If you're curious at looking at more of the different factors, I would definitely recommend you go to this KFF website because they do break it down into so many different charts to look at, like the rates of teen pregnancies by race, or the rates of contracting HIV, or the rates of who has access to actual preventative care, and they all correlate pretty well with the life expectancies. And I think that's definitely something that's important to look at. And so I'm going to be looking at 3 different ethical frameworks today, and the first one that I chose to look at was utilitarianism, because with public health being run mainly by the government, governments typically have to operate under a utilitarian framework just by necessity, because they're looking at what is the greatest good for the greatest number of people. And when we're looking at defining good, I looked at, life expectancy, long life, but also happiness and more quality of life, right? Because if you're living a long life, but you have a lot of chronic diseases, you're probably not getting the best quality or the best enjoyment of your life. And then obviously money and the economics are a huge factor, especially with utilitarianism, with governments, because programs cost money. I think it's significant to see that chronic disease makes up a huge majority of healthcare costs and Medicare spending, but less than 3% is spent on preventative care, which is one of the things that the National Institute of Aging says was so important about healthy aging. So you can see that from a utilitarian perspective, if we were able to put more money towards preventative care, it would in the long run definitely reduce chronic disease and reduce those healthcare costs and what we're spending on treating chronic disease. And this, you can see that would be a utilitarian benefit, not just for the money, but if people are living longer and they're living healthier for a longer amount of time, then you're having citizens that are like more productive members of society and really contributing to that utilitarian good. And another framework that I wanted to look at was RALS. I'm a fan of RALS, and we've talked a lot about RALS in this course. And, looking at stepping behind the veil of ignorance, thinking about policies to enact to benefit the weakest members of society, because if we step behind that veil of ignorance, like that could be us. And, stepping behind and considering that you might be that most disadvantaged member, you definitely want to help create policies that are reducing inequities, health inequities, and social determinants of health, and making it so that everyone has a shot at healthy aging, no matter their race, their gender, their socioeconomic status, or anything like that. And I think that there have been aspects of benefiting the weakest party present in healthcare, such as EMTALA, which made it so that you couldn't turn away people from emergency care just because they don't have the money to pay for it. But when you're looking at the numbers in America, there are still 26 million people uninsured, which means that they are not really being able to access healthcare, preventative healthcare, primary healthcare, which is very important in the process of healthy aging. So definitely making it so that those people can get insurance and get that care as the most disadvantaged people of society is very important. Lastly, I wanted to take a look at care ethics. I like care ethics because it's more of a ethic that places an emphasis on close interpersonal relationships and was kind of formulated as a feminist response compared to ethics that are seen as more contractual impersonal ethics, like when you think of Kant's universalism or just Locke and Rawls and social contract theory. And I'm specifically looking at Virginia Held's synthesis of care. And Virginia Held is a philosopher. She says that a caring relationship or caring person will be attentive to physical needs, sensitive to psychosocial needs, and needs responsive, or operating in a feedback loop to improve levels of care. So if someone you're caring for says, you're not doing this great, you need to improve this to care for me, then you implement that feedback. I think that looking at care is very important because in public health and healthcare, it's in the word, healthcare workers are caring for their patients, and they have to be attentive, sensitive, and needs responsive in order to get their patients the best care to really, prolong their life and make it so that they can age healthily. And I also think that care is needed in our relationships with each other, even though from a government standpoint, it's going to be more impersonal when you look at like this big government caring for each individual citizen. But when we look at, caring for our neighbors and, voting and trying to implement policies that really care about others, I think that's really important when you're looking at trying to reduce social determinants of health and health inequities. So to sum it up, healthy aging is complex, involving many factors, and making healthy aging more equitable and increasing lifespans requires a multifaceted approach of many different things, like increasing access to primary care being one of the primary and preventative care, one of the things that's very important. And utilitarianism, Rawlsian justice, care ethics all point to the importance of equity and making the healthy aging process more equitable, and talking about how we can increase equity, decrease social determinants of health. And I believe together that we can create a society where all people have a fair shot at living long, healthy lives and healthy aging. So thank you. These are my sources. Again, I bolded the source if anyone's interested in looking at more of those social determinants of health by race. And I used a template from SlidesGo. So thank you.